This is the Decoding Obesity podcast, where we simplify, demystify, and decode obesity, helping you lose weight and feel great. Hello and welcome. I'm your host, Dr. Avishkar Sabharwal. So gear up for a fascinating journey through this ever-evolving field, and let's see what we find. And please remember that the thoughts and opinions on this podcast do not constitute medical advice. Don't forget to visit our website, www.decodingobesity.com, for show notes and more info. There is a rising trend globally in the incidence of various cancers. Does obesity have a role to play in this? Let's find out. I have with me Dr. Sonam Puri, who is an associate professor in the Division of Oncology at the University of Utah. She's a specialist in medical oncology with a focus on the treatment of thoracic malignancies. She is an active member of the Lung Cancer Disease Center of Excellence at the Huntsman Cancer Institute. She serves on the National Network Clinical Guideline Panel for small cell lung cancer and is also an active member of several national and international professional organizations like the American Society of Medical Oncology, Southwest Oncology Group, Society of Immunotherapy of Cancer, and International Association of Study of Lung Cancer. Hi, Sonam. Welcome to our podcast.
Hi, Avishkar. It's my pleasure to be here.
So, Sonam, there is an age-old belief in many cultures where, being heavy is looked at as being a good thing. In our society, we're facing this problem of abundance and opulence, and hence we're seeing this pandemic of obesity. As you would know, it's already been deemed as a chronic disease by the WHO. And this disease of obesity links to so many other chronic diseases, and it is so intricately related with these diseases. And now we're seeing this relationship between obesity and cancer as well. So, what do we know about this link? And what seems to be the underpinning mechanism causing a higher prevalence of cancers in obesity?
So you're right, Avishkar. People are very well aware that obesity is related to many chronic diseases like diabetes, cardiovascular disease. It also has a correlation with all-cause mortality. However, we are less aware that actually obesity is linked to many cancers. We know that obesity is associated with at least 13, 14 kinds of cancer. The most common ones are cancer in postmenopausal women like breast cancer, ovarian cancer, endometrial cancer. There is also a link with many gastrointestinal malignancies like pancreatic cancer, cancer of the gallbladder, liver, colon, and even some heme malignancies like multiple myeloma. So we definitely know that obesity is associated with malignancy. So there's been a lot of research done on why obesity is linked to malignancy. And we've been able to identify certain direct effects of obesity that may contribute to either causation and progression of cancer, and then certain indirect ways in which it is related to malignancy. So we know that obesity is actually associated with a lot of hormonal imbalance.
Yeah, that's true.
Yeah. And then having a high amount of adipose tissue in the body leads to elevation in production of estrogen. And we know that elevated estrogen is directly related to a lot of gynecological malignancies, most notably breast, ovarian, and endometrial cancer.
Then there is also this effect of obesity of a chronic low-level inflammation. How does that play into malignancy?
Yeah, so you're absolutely correct on that. So actually, the adipose tissue that is present in high amounts in patients suffering from obesity is in a state of chronic inflammation. So obesity as a disease is a state of chronic inflammation. And we know that this directly modifies what we now know as the tumor microenvironment. And we know that the area which surrounds the tumor actually also contributes to both the pathogenesis and progression of malignancy. So, just being a chronic inflammatory state is what makes obesity linked to malignancy.
And the other thing that we do see in obesity is also the fact that there is oxidative stress that can cause direct damage to the cellular DNA. What other factors do you think, Sonam, link obesity with cancer?
Yeah, so, in addition to increased production of estrogen and just having a chronic inflammatory state in general, patients who suffer from obesity have an increased level of endogenous hormones like insulin and insulin like growth factors. And this is also directly linked to malignancy. And there is now active research that is happening, which is looking at the insulin resistance pathway in malignancy. So that's definitely a correlation that we are exploring further.
The important thing for any patient who's suffering from a malignancy is, will I survive or not? So, what do we know about the effect of obesity on cancer survivorship?
So, yeah, so, even after a diagnosis of malignancy, obesity does have a role in how the cancer course proceeds. And most of the evidence that we have for obesity in cancer treatment and survivorship comes from patients who've been diagnosed with the most common malignancies like breast, prostate, or colorectal cancer. And we know that obesity actually affects every part of their treatment course, from their quality of life to their ability to tolerate treatment, cancer prognosis, cancer progression. More specifically, it's been looked at in a large prospective study that patients who have high BMI of above 40 have a higher rate of mortality related to their cancer compared to patients who have a normal weight and are suffering from cancer. So I think that's definitely something that we look at in our patients, and we do counsel them accordingly when they are diagnosed with a malignancy. We also know that, treatment of any patient with cancer depends on two basic factors: their performance status, that is like how they are in their everyday life and how active they are, and their comorbidities, because that affects our ability to give any treatment directly. And we know that obesity directly has effect on both the performance status and the other comorbidities. So either directly or indirectly, we see that obesity affects a patient's course of cancer therapy.
So, what if a patient decides to lose some weight when they have a malignancy? Does that have any effect on their prognosis or on their recurrence?
From a data driven standpoint, I think the largest study that has been done for this has been in patients with breast cancer. And unfortunately, they did not find any link of weight loss with effect on either prognosis or recurrence of disease. But prior to the diagnosis of malignancy, it has been observed that in patients who are suffering from obesity, the ones that undergo bariatric surgery or achieve weight loss, their incidence of malignancy is less compared to patients who are suffering from obesity and do not undergo those measures to lose weight.
The other thing that we're seeing, Sonam, is an increase in the rate of obesity, especially in the children and the adolescents. How would this increase in the obesity in our younger population affect their risk of future cancers?
So you're correct, Avishkar. We are seeing a pretty high incidence of obesity in children and adolescents, and this does have an effect on their cancer-free survival. Children who are suffering from obesity do have a risk of developing malignancies going forward compared to children with normal weight. And it has been observed that if we do put measures in place so the children lose their excess weight prior to achieving puberty, we can actually reverse this risk. So I think the children and adolescent group is especially a very vulnerable group, but definitely we do have data to support that if we are able to achieve weight control before a certain time point, it affects their overall cancer-free survival.
Yeah, I think with regards to obesity and cancer, prevention certainly seems to be better than cure. I think as a society, we need to realize that obesity is a chronic disease and it has so many ramifications, including an increased risk of malignancy. It has its roots into almost all the other chronic diseases. So we really need to start early and nip it in the bud. So, where do we go from here, Sonam? What is the future in cancer and obesity?
So, Avishkar, this is an area of active research and very exciting research. As I had mentioned before, obesity is a state of chronic inflammation. So, there are actually researchers working on identifying biomarkers of adipose tissue inflammation and developing drugs to target this inflammation in the adipose tissue itself. which would hopefully help in cutting that cord between adipose tissue inflammation and cancer pathogenesis and progression. Also, another area of research is the role of gut microbiome. It's a well known fact that gut microbiome is different between a person who has a normal weight and a person who's suffering from obesity. And that too has some role in obesity's contribution to cancer pathogenesis.
Yeah, that remains an active area of research even in the field of obesity itself.
Yep. And, gut microbiome definitely has a bigger role in everything that we do with malignancy and even treatment of malignancies. We are also actively trying to see if there is any role of modulation of gut microbiome and response to cancer therapy, especially to a specific kind of cancer therapy called immunotherapy. In addition to that, as I had mentioned before, there is insulin resistance with obesity. So there is active research ongoing looking at modulation of insulin receptor signaling pathways. And from an epidemiological standpoint, we know that there is an association between difference in obesity between different ethnic groups. And there are researchers that are looking at this association between obesity and risk of cancer in different ethnic groups.
Yeah, that's very true. I think even as far as obesity goes and its ramifications to other chronic diseases, there do remain differences between different ethnic groups. And as we move forward in the science of both obesity and malignancy, we're realizing that these individual differences in the different ethnicities do play a role in how we manage these diseases. So I think this is going to be very exciting to see how obesity would play a role in different ethnic groups with regards to malignancy. So that concludes this episode. Thank you so much, Sonam, for joining us.
Thanks for having me here, Avishkar.
I will see you guys next time. This podcast should not be used in any legal capacity whatsoever. The thoughts and opinions expressed on this podcast are solely of the host and his guests. They do not necessarily represent the views and opinions of any organization. And that brings us to the end of this show. Thank you so much for listening in. And please remember that the thoughts and opinions on this podcast do not constitute medical advice. Don't forget to visit our website www.decodingobesity.com for show notes and more info.